Have you ever felt that, relentless inner critic, that crushing weight of shame, or just that heavy sense of being stuck, maybe overwhelmed by anxiety?
Uh-huh.
For many of us, I think, this internal battle is just all too real.
It really is.
So today we're taking a deep dive into a really powerful therapeutic approach, one specifically designed to confront these very challenges. Compassion-focused therapy, or CFT.
That's right. And, this isn't just about being nice to yourself in some superficial way.
Right.
CFT is actually a profoundly science-backed method. It's really engineered to create lasting psychological shifts, helping you move beyond those familiar struggles.
Okay, so our mission for this deep dive then is to unpack exactly what CFT is, how it uniquely helps with things like depression, anxiety, OCD, and perhaps most importantly, shame.
Yes, shame is a big one in CFT.
We'll explore how this powerful approach can cultivate motivation and acceptance, and hopefully give you some actionable insights and strategies you can begin to explore.
And we've drawn on some significant research here, systematic reviews, meta-analyses, case studies, to give a really comprehensive understanding.
Great, so let's start right at the beginning. What exactly is compassion-focused therapy?
Okay. Well, it was developed by Professor Paul Gilbert, and it's described as a comprehensive, sort of multifaceted therapy approach.
Uh-huh.
At its heart, its main aim is to enhance psychological well-being by cultivating an individual's innate capacity for compassion.
Towards themselves and others.
Both, exactly, towards themselves and towards others.
And what's compelling, I think you mentioned, is how broadly it draws its wisdom.
Yes, that's what makes it quite unique. It synthesizes insights from, well, all over. Evolutionary psychology, attachment theory, neuroscience, cognitive behavioral theory,
Wow.
and even elements of Buddhist psychology. This wide-ranging foundation makes it incredibly robust, especially when you're addressing that deep-rooted human suffering.
Okay, and if we're talking about compassion in CFT, you stressed it's not just niceness?
Not at all. The definition is really precise. It's sensitivity to suffering in self and others, with a commitment to try to relieve and prevent it.
Ah, that commitment to try.
That part's crucial. It transforms compassion from just a passive feeling into something powerful, proactive, a tool for change.
Okay.
It's less about a fleeting warmth, and more about a dedicated stance you take, almost like building a
I
muscle.
like that analogy.
And it's definitely not a soft approach either. CFT highlights that true compassion often demands significant courage and wisdom.
Right.
Think of a firefighter entering a burning building. That act, it's underpinned by immense courage and strength, all directed towards alleviating distress.
So it's an active engagement with pain, not avoiding it.
Precisely.
Yeah.
Active, resilient engagement.
Okay, that paints a vivid picture.
Yeah.
Now, a central idea in CFT that really resonates is this tricky brain concept. Can you unpack that?
Yes, the tricky brain. It's fundamental. The idea is that our human brains, which, evolved for survival in ancient, dangerous environments.
Right, saber-toothed tigers and all that.
Exactly. Well, sometimes those brains misinterpret modern stressors.
Hmm.
Things like imagined failure at work or social rejection.
Yeah.
And they activate the threat system as if we're facing actual physical danger. Like that awkward email is the saber-toothed tiger.
Okay. I can see that.
And this framework, it's incredibly destigmatizing. It's so powerful because it frees you from self-blame.
How so?
It helps you see your struggles not as like moral failings or personal deficiencies, but as a product of your evolved biology and your personal history.
Okay, so it's not my fault, essentially.
Fundamentally, yes. That realization offers profound relief, really reduces self-blame, but here's the kicker.
Mm-hmm.
This understanding paradoxically fuels a new kind of responsibility.
Responsibility. How?
Not responsibility for having the struggle, but responsibility for how you choose to respond to it. It's a shift from being passive to feeling empowered, having agency.
That's a really important distinction. Okay, so once we grasp this tricky brain idea, it helps us understand the framework CFT uses for our emotional world, the three circles.
Exactly. The three systems model of emotion regulation, or the three circles. It's a core map.
So what are they?
First, you got the threat system, often shown as the red circle. Its job is immediate protection, survival. It activates with any perceived danger, physical or social.
So that's where anger, anxiety, fear live.
That's right. Anger, anxiety, disgust, fear. It's linked to our sympathetic nervous system fight, flight, freeze response. Gets you ready for action.
Okay. System one. What's next?
Then there's the drive system,
Yeah.
the blue circle. This system motivates us to seek and acquire resources, food, shelter, status,
The
achievement.
get up and go system?
Pretty much. It's associated with excitement, pleasure, joy, striving, and like the threat system, it also involves increased sympathetic nervous system activity, that energetic push.
Got it. Threat, drive,
hmm
and the third.
And finally, the soothing system, usually shown as the green circle. This is our innate capacity for care, protection, connection.
Oh, the calmer one.
Exactly. When activated, it generates feelings of calmness, contentment, warmth, kindness. This system is linked to the parasympathetic nervous system, promoting lower arousal, rest, recovery.
Okay. Threat, drive, soothing. Red, blue, green. So how does this link to psychological distress?
Well, distress often arises from an imbalance in these three systems.
An imbalance. How?
Typically, it's an overactive threat system, maybe an excessive reliance on the drive system for validation or escape, coupled with an underdeveloped soothing system.
So too much red and blue, not enough green.
Often, yes, that's a common pattern. So the main goal of CFT is to rebalance these systems by specifically strengthening that soothing system, the green circle.
And that's not just a mental shift.
No, it enables a physiological shift towards calm. It also fosters a more non-judgmental stance towards your own internal experiences, promoting acceptance, rather than fighting or suppressing emotions.
Leading to a more integrated emotional landscape.
Exactly.
Okay, now that we've got the foundations, let's talk about the impact.
Yeah.
How CFT helps people move beyond these deep struggles. You mentioned shame and self-criticism are core focuses.
Absolutely. CFT was specifically developed for people with high levels of shame and self-criticism, often linked to difficult early life experiences.
Wait,
And self-criticism, it's not just a symptom, it's often considered a transdiagnostic vulnerability factor, meaning it contributes to a whole wide range of mental health challenges. It cuts across different diagnoses. So it's a really critical target for therapy.
Okay, so it's not just a symptom, but often a root issue. How does CFT help someone tell the difference between that harsh, shame-based criticism and something more constructive?
That's a great question. It helps you differentiate that shame-based self-attacking criticism from what we might call adaptive, compassion-focused self-correction. It works by cultivating inner motives for caring as antidotes to shame, moving away from self-condemnation towards genuine self-improvement, but from a place of warmth.
And does the research back this up?
Yes, consistently. Studies show CFT significantly reduces self-criticism and shame. The effect sizes are meaningful. And it seems particularly helpful for people who haven't really clicked with other therapies before.
That's huge for people who feel like they've tried everything. What about depression and anxiety? How does CFT help there?
Well, again, it helps by reframing suffering. Using concepts like the tricky brain, it helps you see that your struggles aren't personal failings.
Right, the evolved mechanisms in history idea.
Exactly. This dramatically reduces the shame, guilt, and anxiety often tangled up in depression. And it actually helps increase positive emotions, too.
Does it offer specific techniques for managing those feelings?
Oh, absolutely. It provides concrete, practical tools. CFT emphasizes self-soothing and cultivating warm thoughts, practices designed specifically to strengthen that soothing system.
The green circle again.
The green circle, yes. To counterbalance the overactive threat system that's so common in depression and anxiety, it gives you tools for managing intense emotions, improving distress tolerance.
So it builds emotional intelligence, too.
It does. By reconceptualizing emotions as having evolved functions, it fosters deeper understanding and acceptance. And again, that tricky brain concept, it externalizes the fault, reduces self-blame.
And leads to that sense of responsibility and agency we talked about.
Precisely. Transforming people from feeling passive or helpless to feeling empowered. And the research clearly indicates CFT's effectiveness in reducing depressive and anxiety symptoms, significant reductions in overall negative mental health outcomes.
That shift from helplessness to active management sounds incredibly powerful. What about obsessive-compulsive disorder, OCD? That often feels so isolating, so wrapped in guilt.
You're absolutely right. OCD is often maintained by intense shame, a real fear of guilt, and pervasive self-criticism, especially about the intrusive thoughts themselves. CFT offers a really promising approach here by reducing that guilt, increasing self-acceptance, and dampening the self-criticism.
So it's not just about fighting the compulsions, but changing how you relate to the thoughts.
Exactly that. It emphasizes understanding and accepting the unchosen nature of intrusive thoughts. These thoughts just pop in, they aren't you.
Right.
So it fosters present moment awareness and compassion towards the thoughts rather than that constant futile struggle against them.
Okay.
CFT strengthens self-reassuring skills, helps dampen that overactive threat system common in OCD, leading to better physiological regulation, calming the body's alarm system.
Yeah, you mentioned something interesting about standard OCD treatment.
Yes, what's really compelling is that some pilot studies suggest CFT can reduce OCD symptoms even without deliberately using ERP.
ERP being exposure and response prevention, the usual gold standard.
Exactly, which suggests CFT might be targeting deeper emotional and self-relational processes that underpin the OCD. These studies show significant decreases in OCD symptoms, yes, but also improvements in fear of guilt, self-criticism, and self-reassurance.
That's incredibly significant, a potentially new pathway for relief. It really points to CFT being broadly applicable, doesn't it?
It really does. Its effectiveness across depression, anxiety, OCD, and its focus on these underlying factors like shame and self-criticism, factors that cut across diagnoses. It highlights its wide applicability.
And it was developed for treatment resistance.
Yes, specifically for individuals who didn't respond well to standard therapies. And studies confirm it provides relief in challenging, previously unresponsive cases, including treatment-resistant OCD. It's a really valuable option for complex situations.
Okay, so we've covered what CFT is, how it works, its impact. Let's get practical. What are some of the actual tools people use in compassionate mind training, or CMT?
Right, CMT is very hands-on, very skills-based. It's all about activating that soothing system, the green circle.
So where do you start?
A foundational practice is breathing and body practices, things like soothing rhythm breathing.
What does that involve?
It's basically controlled, gentle breathing with a focus on lengthening the exhale. This directly activates the parasympathetic nervous system.
The rest and digest system.
Exactly. It promotes a real, felt shift towards calm in the body. Body scans are also really helpful for managing that physiological arousal.
Okay, calming the body to calm the mind. What about using imagination?
That's where imagery practices come in. Guided visualizations are key here.
Like what kind of visualization?
Like picturing an ideal compassionate figure, someone or something embodying wisdom, strength, warmth, or visualizing a calm place. These can evoke feelings of safety and compassion. Even imagining giving compassion to someone you care deeply about can actually cultivate the motivation to turn that same feeling towards yourself. It sounds simple, but it works.
That's interesting. And what about that inner critic we all know so well?
Yes, the critic. For that, we use mindful awareness of inner dialogue.
So just noticing the thoughts.
Noticing, yes, but then deliberately responding to them with kindness, like you would talk to a dear friend who is struggling.
Instead of just beating yourself up.
Exactly. The shift is subtle but profound. It's about changing your relationship to the thought, not just trying to erase it.
That sounds like it takes practice. Are there writing exercises too?
Yes, expressive writing, often called compassionate letter writing. This is a really powerful tool.
Writing letters to yourself.
Yes, writing to yourself from a compassionate perspective. It helps process difficult emotions and actively fosters self-kindness. Another useful technique is functional analysis of self-criticism. This means exploring the underlying fears and often the misguided protective functions of your self-criticism.
Protective. How is criticism protective?
Well, sometimes the brain thinks that by being harsh, it can prevent future mistakes or rejection. It's often a misguided attempt to keep you safe. Uncovering that why can be very helpful.
Looking beneath the surface. Okay. What about taking action?
That's compassionate action. This means actually doing things motivated by compassion, both for yourself and for others.
Like self-care or acts of kindness.
Both. Self-care activities count, absolutely. So do acts of kindness towards others. There are other practices too, like attention training, mindfulness, even things like chair work dialoguing with different parts of yourself.
It sounds incredibly comprehensive.
Yeah,
building a whole different relationship with yourself. And speaking of relationships, you mentioned CFT aims for compassion in 3 flows.
That's right. The 3 flows of compassion.
Yeah.
Compassion towards oneself, compassion from others, and compassion towards others.
Why all 3?
Because this holistic approach is really crucial for genuine, lasting well-being.
Okay, so let's break that down. Self-compassion.
For self-compassion, understanding the tricky brain is key, realizing it's not your fault, releasing that self-blame.
Right.
Then you actively develop your self-soothing system using the practices we talked about, supportive self-talk, rituals, maybe supportive touch like a hand on your heart, even something simple called compassion under the duvet when you first wake up, just orienting yourself with kindness. It fosters both acceptance and that personal responsibility we discussed.
Okay. And compassion for others.
That involves things like active listening, engaging in acts of kindness, practicing forgiveness where appropriate, and even just imagining sending compassion to someone you care about.
And the third flow, receiving compassion. You said that can be tricky for some people.
Yes, especially for those with histories of trauma or neglect, it can feel unsafe, unfamiliar, even undeserved.
So how does CFT address that block?
It directly addresses those fears, blocks, and resistances. The therapeutic relationship itself is vital here.
How so?
The therapist actively models compassion, creating a safe, empathetic space. This allows you to experience what it feels like to receive care, maybe for the first time, and begin to internalize it.
Okay.
Group settings in CFT are also really powerful for this, offering a safe container to practice receiving compassion from peers, which helps chip away at shame and isolation.
Those three flows really do create a comprehensive path. So for someone listening, how can they start integrating these powerful CFT principles into daily life?
Well, the absolute key is consistency. Regular practice, even short bursts, is crucial
Why is that?
because you're literally building and strengthening compassionate neural pathways. Think of it like training a muscle.
Hmm?
You need regular workouts.
Right.
Digital support can help too. Apps, guided audio meditations. There's a lot out there now.
What's a good first step for tackling that inner critic day to day?
Just starting to mindfully notice your inner dialogue, that's step one. Then gently challenge the critical thoughts. Ask yourself, how would I talk to a friend right now?
Okay, notice and redirect.
Exactly. And integrate short practices into your routine. Maybe a quick check-in in the morning, a brief body scan during a work break, a moment of reflection in the evening. Little and often.
And what if it feels hard or like you're failing at being compassionate?
That's where self-compassion comes in again. Practice patience and self-kindness with the practice itself. Change takes time. Respond to setbacks with understanding, not more criticism.
That makes sense.
Also, think about your environment. Cultivating a home space that feels emotionally supportive, a safe base, can make a big difference. And if you're a caregiver, modeling compassion, especially around mistakes, is powerful.
And how does all this tie back to motivation and acceptance? That seems key.
When you look at the bigger picture, these strategies build the courage to face difficult emotions. They increase your distress tolerance.
So you move away from avoidance.
Exactly. Away from avoidance and towards empowered engagement and acceptance. It transforms your relationship with suffering. It stops being just pain and starts being a path for genuine growth and finding motivation from a place of care, not fear.
So just to recap, today we've really explored compassion-focused therapy, its unique approach, the tricky brain idea, those three emotional systems. We've seen how this model directly tackles shame, self-criticism, depression, anxiety, even OCD, how it cultivates motivation, acceptance, and inner resilience.
And we've touched on practical, evidence-based strategies you can start using.
Which really leads to a provocative thought, doesn't it?
Which is?
What if the greatest act of courage isn't trying to conquer your perceived flaws, but actually meeting them with unwavering compassion?
That's a powerful reframe.
Absolutely. So, if this deep dive into CFT has sparked your curiosity, if you're thinking about cultivating a more compassionate relationship with yourself and your challenges, we really encourage you to explore CFT further.
And practices like those offered by Edward Jenny and Associates can provide a really supportive path towards that lasting well-being.
All right. They emphasize feeling understood, using a team-based approach, sophisticated assessments to get to the root of issues faster.
Yes, they support a wide range of challenges: depression, anxiety, OCD, stress, relationship issues, trauma, grief.
And they believe therapy and assessment go hand in hand, providing a safe, fast way forward using that data therapeutically.
You can connect with their team easily, send an inquiry, call them, or book a free consultation online. They offer in-person therapy in West Grove, PA, and telehealth across Pennsylvania.
A great potential next step for anyone interested.